Hi guys, we're back again for another review on AV Block. This time I've created you guys a PowerPoint um, with some little funny slides that will hopefully help to remember this. I always like to make things fun. That's how it helps me to learn it. So hopefully it'll work the same for you guys. Anyway, getting started, we're going to look at this slide here. Just shows an example of all the AV blocks and just gives you a view of the strips so that, to help you see exactly what, in comparison, what each one of them looks like. So let's start with our first degree block here, in which we see we have, look at our PR interval. Here's our PR intervals. Okay, they are a little prolonged, but the P waves are normal and our QRS is normal. Okay, usually with our first degree block, the patients usually don't require any actual treatment, just monitoring and removing any known causes that may be causing them to have the block. Okay, moving right along to our second degree type 1 or Wenckebach. Here in our Wenckebach, we have an irregular rhythm. Our PR intervals become progressively longer. If you look here, we're starting, look at this PR interval, then it gets a little longer right here, and then eventually it drops your QRS complex. Okay, here's our second degree Mobitz type 2, and here again we have an irregular rhythm. Our PR interval is normal. However, you have more P waves than QRS waves. Okay, so look here. Here we have a P wave. You see here's our P, QRS, and our T, and then we've got another P wave. We've got a P wave here, and then another P wave at the beginning of this QRS. That's an indicator of a second degree Mobitz type 2. Okay? And then our third degree, here we have our P waves or have no relation to our QRS complexes. And these, we haven't really talked about these, so I'm not going to confuse you guys. We're not going to go into any detail with these, okay? Here's yet another slide with just another view of them all together, okay? And you guys, you will have to just like study these. It takes a while to get used to them, so don't panic. You just have to study and practice. And of course, if y'all have any questions, you most definitely can give me a call. So let's look at, when we're looking at AV blocks, we're looking at that PR interval. So here's how you measure that PR interval. You're going to start at the beginning of that P, and then you'll measure all the way over to the beginning of your QRS complex. So if we look here, remember each one of these little boxes are 0.04 seconds. So we see here our PR interval, and that's what we're going to be counting. When we count the PR interval, we're going to count the little blocks in between, okay? That PR interval should not be greater than one big box. If you have a PR interval that's greater than one of the big boxes, then you're looking at some type of block, okay? And here again, this is a good example that shows you that PR interval. So here we have a normal PR interval, okay? And then we have a long PR interval. And you can clearly see our big boxes, it is way outside the big box. So that's an automatic indicator that you have some type of AV block. Okay, and yet just another example of strips of being able to look at them all together. So you can see distinguishing characteristics of each. Here is our AV block poem. If there's an R, if the R is far from P, then you have a first degree. Okay, prolonged interval. If it gets longer and longer and longer and then it drops, then you have a Winky Bach. If some P's don't get through, then you have a Mobitz 2. And if your P's and Q's don't agree, then you have a third degree. And here we are, one of our little funny slides. This is just a funny illustration of your first degree. And here we see the pizza pulse, the delivery in less than 0.2 seconds, or it's free. And he says that he's late again, which he's talking about the PR interval. It's more than 0.2 seconds. And here you have your QRS complex arguing with your T wave. Okay. PR remains consistently lengthened cycle to cycle. Here's an illustration of that. And then your QRS says, are you sure you ordered the pizza? And the T wave says, it's like this every time. Now here's a funny illustration of your second degree AV block, or your Mobitz type 2. And here again, we have our QRS, P, P, QRS, and then you're going to drop, it's dropping a QRS. Okay. And then out down here is an illustration. I didn't do an actual slide of the 2-to-1 block, but this right here is showing you a 3-to-1 block here, in which you have 3 P waves before a QRS. So in our text, it only talks about the 2-to-1 block, in which you will have just 2 P waves to that QRS. Now the thing with your Mobitz type 2 that you will want to remember is these patients need to be monitored, because they can progress quickly into a complete heart block. And here again, we have an example of our Mobitz type 1, in which, or our Winky Bach. Let's see, it's not coming in all the way clear, but sorry guys. Anyway, like I said, it usually occurs at the level of the AV node. And here she's saying, I love the love dubstep. And here we have the DJ Moby 1 Kenobi. And here we have progressive prolongation of the PR interval until the beat drops. Okay. And here on this one, when we get to that third degree, it's bad. Okay. The P waves and the QRS complexes are doing their own thing, and this patient is at great risk for sudden cardiac death. And the reason being, you have no communication going on between the atria and the ventricles. Okay. And so at this time, this is when you will see staff running. Okay. This patient is coding. Okay. So for your assignment, I want you to create a funny story or song, whichever you like, and include all the AV blocks, label them and their name, and submit a picture. When you're done, you can make it as funny or as weird as you like. Just make it something that will help you to remember how to distinguish these blocks, okay? And continue to study and prepare for your exam. I will talk to you guys tomorrow. Bye-bye.